Welcome to Community Health Workers' Role in Advancing Equity. County Health Rankings and Roadmaps is a program at the University of Wisconsin Population Health Institute. This program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation, including the Robert Wood Johnson Foundation. Hi, my name is Erica Burrows-Girardi. I am the Senior Outreach Specialist here at County Health Rankings and Roadmaps. And today I am joined by colleagues who will assist in your learning experience. I want to start by introducing you to a new face, Tommy Jaime. Tommy joined the CHR family earlier this month as a communications specialist. Tommy comes to us from Special Olympics in Wisconsin, and he holds an MA in Communication and Leadership Studies from Gonzaga University. In his free time, Tommy enjoys spending time with his two children, running, hiking, and skiing. Welcome, Tommy. Oh, you are on mute. Folks want to hear your lovely voice.
Thanks, Erica. Sorry about that. Hi, everyone. I'm excited to be here. Today, I'll be chatting with you in the chat box. And when chatting, please be sure to use the drop-down box and choose chat to all panelists and attendees before sending your message. This way, everyone can see your chat. If you have a question, please be sure to place it in the Q&A box where Joanne will meet you. Joanne is the Collaborative Learning Director with Healthy Places by Design, which is one of our national partners. Hi, Joanne.
Hi, Tommy. Hi, Erica. Thanks so much for the introduction. As Tommy mentioned, Joanne Lee with Healthy Places by Design. We're so pleased to co-produce these webinars with County Health Rankings and Roadmaps. And as Tommy mentioned, remember to use the Q&A box when you have questions for the presenters or for us. I'll be monitoring that, and we'll try to address as many questions as we can with the time we have today. And don't wait to submit your questions at any time. I'll be keeping a list. I also want to introduce all of you to James Lloyd. James is our wonderful technologist, and he does so much behind the scenes in addition to working a little bit of magic around technology so that we can bring these webinars to you. Hi, James.
Thank you so much, Joanne. It's, as I often say, this is such a privilege for me to be able to help and contribute to these worthwhile topics. I'm available on hand to help our presenters and panelists. And also, if anyone in the audience has a difficulty, please just chat into the presenters and panelists chat, and I'll do what I can to help out. So with that, I'll hand it back to you, Erica.
Thank you, James. And I'm excited to introduce you to our distinguished guests today. I want to start with Ashley Rodriguez. Ashley is an experiential community health worker. Well, you'll hear me say CHW a lot because we like to use acronyms in public health. But Ashley is also a CHW instructor and has been so for over 13 years. She also has experience in community and public health. Ashley is currently the CHW System Manager at Baylor Scott and White Health Systems, located in Texas. And she serves as the CHW Section Chair at the American Public Health Association, which we call APHA. So welcome, Ashley.
Hi, thank you, Erica. Hello, everyone.
And Ashley, I think I heard that you are going to be at APHA in Denver this fall. Is that correct?
Yes, I'm really excited to be there.
Great, awesome. Well, if any of you are going to be at APHA, make sure you stop by County Health Rankings and Roadmaps table in the exhibit hall because we'll be there too. So I'm looking forward to meeting Ashley in person in October. And then also I want to introduce you to Jenna Grant, who is the Resource Development Manager of Tulsa Health Department in Oklahoma, and also of its nonprofit branch, which is called Pathways to Health Community Partnership. So welcome, Jenna.
Hey, glad to see everybody.
Thank you so much, Jenna, for joining us. And you can learn more about our amazing guests by reading their biographies on this webinar's resource page. But Tommy's also chatting a link out to you that includes their bio. So thank you so much for doing that, Tommy. Now, by the end of our conversation today, our goal is to have answered these three questions. Who are community health workers? What are their responsibilities? And perhaps the most important question, how does the work of CHWs advance equity and how can you support them? So I hope you are looking forward to this awesome topic. I know I am, and I will tell you that this webinar is one that is in direct response to you, our audience's request for more information about CHWs and their value. So if you are just as excited about this webinar and you are an active Twitter user, will you do us a favor? I want you to visit our Twitter page right now at CHR Rankings, and I want you to retweet the invite that our communications associate just posted on our page. So I'm actually giving you permission during the webinar right now to take out your phones, go to Twitter. I'm doing the same, and just retweet that invitation. And I'm going to tell you why. What is so important about this tweet is that we want people to know how important community health workers are to advancing equity. And if you are in the space of having to make the case for their value to decision makers or community partners, you're going to want them to be a part of this webinar. So please take a moment to retweet that. And I appreciate you for doing that. Thank you. Some of you might be new to our organization, so I want to tell you what our primary goals are, and it's actually pretty simple. County Health Rankings and Roadmaps exist to improve health outcomes and advance equity. We encourage community change makers like yourself to start with data to identify who isn't thriving, and then we will point you to evidence to share what research is showing works. Then we share guidance to help change makers take steps to action, like actually creating change. And then lastly, we share inspirational stories and examples of what community change looks like. It's like this webinar. In this webinar, you're going to actually hear just how these communities have been able to incorporate the wisdom and lived experience of community health workers to advance equity in their communities. So CHR&R is comprehensive in that our goal provides tools and resources that move you from data to action. So in the end, everyone in your community has the opportunity to thrive, no matter their zip code or the color of their skin, age, or any other aspect that makes us unique. To learn more about County Health Rankings and Roadmaps, be sure to watch our CHR&R 101 webinar on demand. And Tommy's going to chat a link to that webinar right now. You're also going to receive in your inbox tomorrow a resource page that includes the resources we'll be discussing in this webinar, as well as some other CHR&R resources to help you in your work around equity. So speaking of evidence, like I was saying, evidence is one of the things that we love to share with our audiences. What do you think the evidence shows about the benefits of community health workers? Well, our evidence and policy team here at County Health Rankings and Roadmaps has actually done some homework for all of us. Community health workers is one of the strategies listed in our What Works for Health tool. And I'd like to call our evidence analyst detectives because they're constantly looking for the evidence around strategies. So we are informed when we pick a strategy to implement in our health equity building work. You'll be happy to know that evidence shows that when a community employs CHWs, it leads to an increase in patient knowledge, access to care, health behaviors, and preventive care. Additionally, the use of CHWs is likely to decrease disparities, which is what we all want, right? So all of these benefits contribute to equitable health outcomes. So just before we really get into the meat and hear more about CHWs and how they're uniquely positioned for equity, let me share about an exciting opportunity for you to process what you're learning today. We will hold an interactive discussion group to deepen your learning after today's webinar. Now, a lot of you have been part of these conversations, and you know that they give you a chance to be face-to-face with other webinar attendees to share what you're doing locally, as well as ask questions of the participants. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design, and Joanne, whom you've already met, will be our lead facilitator. And I'm happy to say that Ashley and Jenna are also going to join us for the discussion. Later on in the webinar, Tommy's going to chat out some details about how you can connect. So if you have time on your calendar, please plan to spend it with us after the webinar. So with that, please join me in welcoming back to the mic, Ashley Rodriguez. And Ashley, I'm sure there's many in our audience who have heard of the term community health worker or CHW, but some there might be like various perceptions floating around about what they do, various stereotypes even of who they are and what the roles that they play. So before we even start our discussion, let's kind of set the table and get a shared understanding of community health workers. How do you define a community health worker?
Yeah, definitely a good touch base to start with. So whether it's a community health representative, also known as a CHR, promotora de salud, or other term that we use under the broad umbrella of community health workers, I'll simply just emphasize that we are trusted community members with lived experience, often reflecting the communities that we serve. And we're known for inherent traits that cannot be taught, like personable engagement, adaptability, and resourcefulness. And what I like to call and what we're known for is sometimes referred to as the 3 E's, which stands for engaging, empowering, and educating. And it's also important for me to note that self-determination is a huge part of the community health worker workforce. Our mantra is nothing about us without us. So we're able to develop and lead our own training from within the workforce. And while community health workers serve nearly every sector and represent a variety of linguistic, racial, ethnic, and geographic communities throughout the US, we're all, in the words of the American Public Health Association, essential frontline public health workers who are trusted members of and or have an unusually close understanding of the communities they serve. We often provide critical outreach services, conduct community-based education, meeting the population that we serve where they are both physically and mentally. We provide informal counseling, social support, addressing isolation, and ultimately providing advocacy for health and social issues that communities experience. And many of you that are caregivers that are joining us today or in other various roles may find yourself thinking, that kind of sounds like me. I think I might be a community health worker. And honestly, you probably are.
Yeah, and as you were going through that description, it kind of took me back. I mean, I'm a breast cancer survivor, and I distinctly remember like during that treatment period, I was afforded what was called like a patient navigator, and she provided an enormous amount of support for me. I remember her talking to me about like my diet, helping me arrange transportation, like when I wasn't feeling well one time and had, couldn't drive to my treatment. I remember her talking, just like giving me support, like when I was sad or depressed. So was she a community health worker?
I mean, yes, it sounds like she probably was. Often CHWs may not have that role as their official title, but
Mhm.
navigators often help patients with new diagnoses or complex health needs to navigate the health systems that provide support. So, which kind of leads me into the next piece of this. Contrary to popular belief, community health workers are not merely volunteers. We are part-time to full-time paid staff. And we're not merely translators either, although, of course, some community health workers that are bilingual may be certified or trained to do this. And we often implement the cultural and linguistically appropriate services that are also known as class standards. And I just want to note here too that CHWs may be in a clinical or a non-clinical setting, like the navigator that helped you.
Right.
But if they're out in the community, often their primary focus area, regardless of that setting, is intervention through that peer education and outreach and support. So some of the skills and functions that community health workers fulfill are social needs assessment, community resource connection, peer support, building that trusted patient relationship, which it sounds like your navigator was doing for you, engagement and socialization. And then last but not least, just utilizing those self-motivation and empowerment strategies that they already kind of have in their back pocket.
Awesome. And I know Tommy has actually chatted out some information about the national class standards for you to learn more about that. CHWs are professionals, and we need to recognize that. But is certification required, or are there other options for reimbursement, such as licensure for them?
Great question. So certification still varies widely state by state, as you can see on this map here. So less than a dozen states currently have a state operated certification program. And recent research found that 47 states have made efforts to establish statewide definitions, standards, and policy for the CHW workforce. And 41 states have efforts dedicated to organizing the CHW workforce. And then 45 have a multi-stakeholder coalition at the state level. And 31 states have statewide CHW organizations that are comprised primarily of community health worker members. In Texas, for example, we've been fortunate enough in many ways to be the first state in the US to have formal certification, which does come with its own unique challenges. So for better or worse, it's overseen by the state health department, which was gained through an act of legislation. And it's important to note that there's not one set standard or practice nationally per se, but often programs or focus areas are the same in both the purpose and the outcomes. And last, I'll just add that, approximately 31 states do utilize and reference the CHW Core Consensus Project recommendations that include a total of 10 roles and 11 skills for community health workers.
Great. And you're probably wondering if you would have access to this map. I want to let you all know that first of all, Tommy has chatted out a link to the slide deck, so you have this in your slides. But also, Joanne has placed a link for this map in the resource guide, so you can directly link to this map tomorrow when that resource guide lands in your inbox. Now, Ashley, one of the questions that I hear a lot is, where are CHWs typically employed? Can you help us with that?
Yeah, so community health workers are in all communities across the US and arguably internationally. But this map from the US Bureau of Statistics from 2020 shows employment rates at that time. But keep in mind, sometimes they're just simply proactive, engaged community members that connect with their neighbors to address social needs and resources, or provide that general education on how systems work for access to care, or those direct services that are available in their neighborhood. Community health workers can be employed not only by, again, health systems, but also public health departments, institutions of higher education, public school systems, community or faith-based organizations, and nonprofits such as homeless shelters, or organizations that address food insecurity, or tribal programs and government agencies that often rely on community health workers for community-based outreach and education. One example to illustrate these various roles across institutions of higher education across Texas and arguably across the country is they often hire community health workers for specific research grants that rely on them as research assistants to recruit participants, obtain informed consent, and to execute specific disease interventions ranging from HIV to chronic disease. And another one is the Navajo CHR program that partners with the nonprofit Community Outreach and Patient Empowerment, also known as the acronym of COPE, to provide home-based outreach to Navajo clients living with diabetes. And honestly, the role itself is really only limited by those who do not fully understand what and who we are and what our capabilities are.
Right. Yeah, so, that leads to my next question, which is, what is the unique role and niche that CHWs play as part of a healthcare team?
Yeah, so within a healthcare system, community health workers can and should be fully integrated into patient care teams that often consist of a physician, a nurse, a social worker, a pharmacist, and possibly other roles like chaplains to provide that whole person care. Community health workers help to combat that white coat syndrome simply by
Mhm.
being viewed as a peer. And so, whether they're a chronic disease educator or a general kind of health educator, navigator, or an other primary focus area in that clinical role, they address health literacy by using methods like teach back to truly know what the patient understands in terms of their next steps, medication, instructions, and whatever else the provider has explained to them, and ultimately to help navigate the complex health system environment. Because community health workers not only help to navigate that complex care system, but also with care coordination in general. So they're often providing that warm handoff from one provider to another or another
Yeah.
care team member within the hospital system. And so community health workers might also conduct home visits for patients that are high risk, high needs, that have had missed appointments or simply lack transportation to their clinic appointment. Like you mentioned earlier, it wasn't necessarily that you lacked it, but you did need some assistance, right, in getting to
Right.
your appointment. And so in terms of specific focus areas of education and outreach, that can range widely depending on if it's, providing oral health information, supporting individuals with HIV within the maternal health arena, or providing behavioral health support, or generally addressing any of the social determinants of health, such as those social needs we've kind of touched on already, connecting to resources like housing, addressing food insecurity, direct referrals to food pantries, but often providing that warm handoff to extend to those external organizations for those direct services that the patients need. And I'd also like to note that CHWs are sometimes dual certified medical assistants, pharmacy techs, or even doulas.
Yeah, I mean, and as I think about how complex our healthcare system is and is continuing to grow in complexity, I can definitely see how CHWs can be an asset to help just make that connection for the patient. It's makes care more patient-centered focused.
Exactly. And even addressing just the benefits they get with their healthcare plan and what's available. I
Right.
know I'm going a little off script there, but I did want to point that out. A lot of times they're reviewing their coverage and explaining to them why they might need multiple coverages or
Mhm.
they're underinsured, those kind of things.
Well, when was the last time somebody did not need help with their health
Right.
insurance
Right. We all need it.
Exactly. And as you were chatting, a little bit in that previous slide about all that they do, it's beginning to click for me about how they are uniquely positioned to address equity in communities. Share a little bit more about how they're just perfect if we are looking to strengthen our work in equity in community.
Yeah, so as I mentioned briefly before, we often use the national standards of culture for culturally and linguistically appropriate services, class, in health and healthcare. And these are increasingly recognized as effective in improving the quality of care and services. The national class standards align with the HHSC action plan to reduce racial and ethnic health disparities and the national stakeholder strategy for achieving health equity, which aim to promote health equity through providing clear plans, strategies, and to guide collaborative efforts that address those racial and ethnic health disparities across the country.
Yeah, so thanks for that. And you're also sharing how much they are into educating and empowering community members.
Exactly. Yeah. So community health workers are known generally for educating and empowering community members to lead any number of efforts related to social justice or even just change within neighborhoods. So whether their target audience is immigrants, migrants, those experiencing homelessness, the aging population, people experiencing mental health issues, or even the LGBTQI community, community health workers use their unique skill set to meet people where they are, again, physically and
Mhm.
mentally. and to support them in a wide range of activities that often start with an assessment, some form of education, possibly informal counseling, and of course those linkages to appropriate services. And so if a CHW discovers that a needed social or health service is not available in their area, they often start grassroots efforts to advocate for those needed services. And that may very well include starting a petition, contacting a health department leadership, their city councilors, mayors, or even state legislators.
So I'm hoping for all of you in the audience, you begin to connect these dots now. You can start to see how crucial CHWs are to any equity effort. Given the work that they do, the breadth of their skills, actually, this conversation that we're having is naturally leading me to think about the COVID-19 pandemic and how we've all been managing that, this year in our respective communities. Can you highlight a few examples of how the roles that CHWs played within the pandemic to mitigate it?
Yes, there are a ton of articles and online publications that explore the community health workers' role in the COVID-19 response, as shown here. I mean, so many community health workers, including my Baylor Scott and White Health colleagues, mobilized to host drives for needed household items when people couldn't leave their house, right? When it wasn't safe to go to the store, or for those that even just lack transportation. For household items like paper towels, dish soap, food essentials, and such that were just provided to community members and patients through porch drop-offs. And many, including myself, were also providing education safely, virtually through social media platforms like Facebook Live, for example, stressing the importance of masking, social distancing, avoiding large family gatherings like birthday parties, and hosting, live Q&A with trusted bilingual providers. I personally did help put on several events like that, where we had medical experts and community health workers sharing the information and answering the questions in real time. And, some community health workers were simply just helping to canvass neighborhoods, aiding in posting guidance signage or passing out masks and sanitizer. And, really focusing on building that vaccine confidence once the vaccines came out within communities. And this is still a key area of focus right now for all community health workers nationally. Many of us are working with institutions of higher education, our cities, local coalitions, and other public health partners to provide, to continue to move that needle. And in terms of the number of people vaccinated in our communities, because, I'm as County Health Rankings is aware, we're at that very hard to reach population, both in terms of still access in some areas, but mostly education. And I had the privilege of working with the CDC's COVID-19 task force to provide a webinar to Texas community health workers on this very topic back in April. And we were able to reach over 150 community health workers and really focus on building that vaccine confidence, which leads to strengthening communities' resiliency through self-care techniques and sharing free community-based mental health resources as needed as well.
Wow, cool. Tell us about this tool.
Oh, yeah. So I also wanted to share this tool, Advancing Community Health Worker Engagement in COVID-19 Response Strategies. And the subtitle, if you will, is a playbook for local health departments in the United States. And this was developed with for several key players, all contributed from the Community-Based Workforce Alliance, which I'm a part of. The goal of this document is to facilitate both the conceptualization and operationalization of community health worker engagement to advance health equity throughout all COVID-19 response activities. And It has two primary parts. Part one is a framework for engagement across 10 key areas. I highly encourage you to take a look. And then part two is strategic recommendations for advancement.
Awesome. Thank you for sharing that with us. You all know it's going to be in your resource guide. So sit tight for that. That'll be in your inbox tomorrow. Sustainability is a question that we at County Health Rankings and Roadmaps get a lot from folks in community looking for ways to sustain their community health workers. So can you share an example of a sustainability model that might be adapted for communities wanting to build a CHW program?
So, unfortunately, many community health worker programs are tasked with demonstrating the value or the return on investment of a
Yeah.
CHW program, which can be actually pretty difficult if community health workers are truly embedded within a care team or any other type of team. And it can end up being an undue burden for most nonprofit and government agencies that employ community health workers. And I say this to also point out that other roles like educators or nurses are not asked for this type of data. Everyone knows what
Right.
services they provide, how effective they are. And that having been said, sustainable financing models are typically tied to very specific health outcomes and evaluations. So there's really no set standard. And several states have had Medicaid waiver programs that temporarily paid for community health worker programs. And some are even looking into the use of Z codes, which are medical codes that can identify issues related to a patient's socioeconomic situation or the social determinants, but they're not yet required. And so, although these are potential promising practices, there's just not truly a one size fits all solution.
Yeah.
And the Centers for Medicare and Medicaid Services, or CMS, issued guidance in January of this year to state health officials designed to drive the adoption of strategies that address the social determinants in Medicaid and in CHIP, the Children's Health Insurance Program. And so, with the potential for states to further improve beneficiary health outcomes, reduce health disparities, and lower overall costs, which may also have applicability for community health workers in various states.
Mhm.
And the examples for these are on the slide for these specific
Yeah.
programs are now a little semi-outdated. So keep that in mind as well.
Yeah, I appreciate you just being open and frank that this is really a sticking point. And this is a challenge that we as community, as public health advocates, really need to find ways to overcome. I want to encourage you, if you have some time to join our discussion group afterward, we would love to hear from folks in the audience if you have found a sustainability model that's working that you can share with other people. So please plan to come to our discussion group if you can attend. Thank you so much, Ashley. But don't go because we have questions for you, I'm sure, that I can, in our Q&A section. So, but one of the things that I really love about our webinars is our commitment to sharing local stories. And we do this so you can learn what others have experienced and what they have sought to implement, like what strategies they're using to advance equity. And this next story that we're going to hear about really delivers on that. And with that, I want to ask you to join me in welcoming back Jenna Grant. And Jenna, I know that you've been involved in efforts to achieve statewide CHW certification in Oklahoma for a while. And, sharing your story can be both instructional and inspirational for our audience. So I want to start by asking you to share what compelled you and your partners to seek CHW certification in Oklahoma.
Sure. And Erica, before I even answer the question, I just have to say this is the friendliest call I have been on in the longest time. Like everybody's so friendly and introducing themselves. I even saw some familiar faces out there. So a shout out to Reinschmidt. Yeah, she was actually one of the trainers that we had in the program I'm going to talk about in a little bit. So I can't wait to meet you guys on the chat. It'll be cool. But to get back to your question, so you asked about what compelled us to seek certification for our community health workers. And Ashley did a great job. We know that certification is important. And in Oklahoma, we've got a really long history with CHWs. So going all the way back to the 1960s through the community health representatives serving our Native American communities, their Indian health services. And I've been more of an advocate of the certification efforts in the state. It's folks from the Oklahoma Public Health Association that have really been the ones leading the effort. They've been able to bring together different organizations from across the state to help make certification happen. And it is so important in a place like Oklahoma. We've got high rates of poverty, large rural populations, and we also have a history of racial disparity.
Yeah. So how did you build a case for CHW certification? Like, was there opposition in that work?
we're still building that case. So
Mhm.
certification hasn't been approved in Oklahoma yet. It looked very likely in 2020, but it didn't happen. And across the state, I wouldn't say there's been opposition really as much as apathy. So I think until people see community health workers in action, until they learn about some of the information we've heard here today, they sometimes don't understand how CHWs can benefit the whole healthcare system. And they're just so much better than an emergency room visit.
Yeah. Go ahead. I'm listening.
It's incredible. They're also cost effective.
Mhm.
So the American Medical Association had this article last year referencing the benefits of community health workers, and it was taken from a case study in New York. You can see for yourself that there is a big return on investment. And Ashley, mentioned how hard it can be for a program to make the case and to gather the research needed to build sustainable programs. I think that combining information like this from bigger studies and then, pairing it with the information that you have from your program can really help build your case. So the stat that impressed me shows that we have a net savings of $170,000 in medical costs per year for each community health worker.
Wow. Now, folks, that we're going to share the links to this article because we know how important it is. Case making is very important. And the other thing is this webinar is going to be on demand on our website. So as you begin to have those discussions with partners and decision makers in your community, I encourage you to ask them to watch this webinar so they can learn more about community health workers and how they can be such an asset to a care team or to a community. Jenna, I want to ask you about the support that you received from Healthy Places by Design for training.
It was, it was just a real blessing. So we received that support from Healthy Places by Design and County Health Rankings and Roadmaps, and we used it to host the Route 66 Community Health Worker Training. And that was the one that I mentioned where we actually have trainers on the call. So it's good to see everybody. Our goal with this program was to help any health worker from across the state to be prepared for certification once we do have it in Oklahoma. So in putting it together, we surveyed local community health workers, and by local, I mean across Oklahoma. We reached out to partners in other states like Arizona, Texas, and Massachusetts to learn which topics we should include. And it was interesting. The participants were all about the practical skills, those sessions. But in the post-training evaluations, we heard a lot that the information from the CHWs as a workforce session on the history of community health workers, the type of work done by CHWs throughout the world, that really helped them to see the impact of what they do every day.
Wow. So they were even blown away by their own value. So we heard from Ashley earlier about community efforts that CHWs have been involved in throughout the pandemic. And I know that you and your community partner had some opportunities arise within Oklahoma as well to address the pandemic. Tell us about that.
We were able to use that Route 66 community health worker training to make a case as we applied for funding from the Rockefeller Foundation. So Rockefeller wanted to know the effectiveness of different methods that could be used to provide COVID outreach to vulnerable populations. And we used that funding and ran it through the nonprofit branch of Tulsa Health Department to develop Rapid Results Tulsa. And in that program, we had bilingual community health workers connect underserved people to COVID testing and other resources in a culturally sensitive way.
Nice. So what did Rapid Results Tulsa, what are some of the communities they were able to reach in this program?
Yeah, the outreach started with our Latinx and Burmese residents. They were some of the very first who were affected by the COVID outbreaks.
Mhm.
And the campaign, as you can see, from the screen, it highlighted local iconic images, and we shared it in English, Spanish, Zomi, and Burmese. And the ads had themes that resonated with the communities. Like we had a text message between a person who just found out they were COVID positive, communicating to their boss. Or we had another with the theme of kick COVID, get back to life, with a soccer ball being kicked. And soccer is huge for a lot of Tulsans who are Latinx or Zomi.
And so it just really resonated with them. Like you said, it was just totally culturally appropriate. And I understand that Tulsa has a significant number of residents with Burmese heritage. Last month, some of you on this webinar, may remember that webinar last month was focused on strategies to advance equity among Asian Americans, Native Hawaiians, and Pacific Islander residents. And one of the strategies that was that they talked about on that webinar that was so successful was employing CHWs who understand the language and the culture of the populations they serve. Jenna, can you share some examples of how CHWs help advance equity for Burmese residents there in Tulsa? And are the CHWs themselves Burmese?
So a little known fact is that Tulsa is considered the Zomi capital of the United States. We have about 10,000 Zomi and Burmese immigrants from the Myanmar region. And the community health worker who we hired for Rapid Results immigrated herself from Myanmar when she was 15. She learned English. She graduated from high school and then from college. She worked as a certified translator for the local schools. And now she's working with our program until her medical school classes start this fall.
Nice.
So she's a rock star. And she knew how to reach out into the Burmese community because most Myanmar immigrants fled religious and ethnic persecution. They have a really strong connection to their faith communities. And in Tulsa, we've got 5 big Zomi churches, and our community health worker went to every service, every Bible study, every youth class. She reached out to local businesses, helped set up a vaccination event, and she even shared about Rapid Results as one of the organizers of the Zomi World Cup soccer game that Tulsa got to host this spring for athletes from 20 different states from the US.
Wow.
So yeah, and the community health workers, like Ashley mentioned, they not only did translation for the printed materials and ads, they really were a mini focus group as we developed flyers and other materials. You can see on the screen there that in the flyers, they even recruited local business and church leaders from the Latinx and Zomi populations to lend their influence to the program. The CHWs did media posts, they did radio interviews that they set up themselves. A couple of times clients called in and were thrilled to find out that the health worker who they were talking to was the person from the ad. Like it was like talking to a celebrity, right? After you're getting, all these ads on YouTube and Twitter and everywhere, right? So one quick note was a problem that we ran into when we were distributing handouts like these at a drive-up food bank. We obviously couldn't know the preferred language of people coming through the line. So at the suggestion of our Zomi community health worker, we printed up one side of the flyer in Spanish and the other side in English with the line at the bottom in Zomi saying, call for COVID testing and help. And you could see that in the image there in the center of the screen. It has that little Zomi line. So our team was just brilliant at identifying problems, coming up with the solutions. Our Zomi community health worker also had insight in a really difficult situation. So she was sharing the Rapid Results messaging when social media was being flooded with information about the political coup that took place in Myanmar in February. And Myanmar, like I mentioned, is that country where most Zomi and Burmese people from Tulsa immigrated from. The community health worker on the project and most of the clients who she serves still have family in the region.
Yeah, and we're seeing some albeit disturbing images from here in Myanmar. What kind of trauma did Zomi and Burmese residents experience in Myanmar before moving to Tulsa, and how did this community health worker's lived experience help her to understand how to support them in the trauma that they were navigating?
Yeah, it was bad before this year. The best example I can think of that is when our health worker was one of the planners for the Zomi World Cup soccer game. There was a gentleman on the planning committee who needed to call an off-duty police officer to be security at the event. And he was terrified to call a police officer because of what he'd experienced. And with the political coup, it became brutal. A recent CNN report said that the security forces in Myanmar are shooting people in the street. They've laid siege to entire villages. The internet's not available. Banks and airlines are closed. There are widespread reports of people being imprisoned and tortured. And COVID has added just an extra layer of desperation to this. Some doctors are afraid to report to work because they don't want to be targeted by the coup leaders. People can stand in line for hours trying to get into a hospital or to get oxygen for a family member. It's unbelievable. And
it's very traumatizing.
It was, the rapid results Tulsa sounds small, but we were just glad, even in a small way, to take one less stress off, people who live in Tulsa now, but who, immigrated from Myanmar and that region, so that they wouldn't have to worry about COVID on top of all this.
Wow. What an amazing story, and hats off to that community health worker who literally ingratiated herself in the community, talking about authentic community engagement, ingratiated herself to be able to be of service to the folks that are coming here from Myanmar. Hats off to her. I know the information that you did make information available in Spanish, but other than just sharing information, how did CHW serve the Latinx community during the initial stages of the pandemic?
Yeah, our Latinx community health workers were just as gifted in reaching out to the community. They went to schools, to local businesses, apartment complexes, and left flyers on every door. I mentioned food banks, flea markets, and attended Cinco de Mayo and other community events to help anybody who might need COVID testing. And this was before a vaccine really came out. So, they also obviously helped connect people with vaccination once that was available. So because this was grant funded, we were able to offer really concierge level COVID testing. We had a local lab with bilingual staff and also a mobile COVID testing service provide the tests. And the community health workers translated the consent forms, the results paperwork, so it was all accessible. They were also available by phone, by text, email, Facebook, Instagram. And our first access code for people to get the test was either good or bueno. We really wanted this service to be a blessing to people in the Zomi and the Latinx community. It was great to see it help people, and it made contact tracing a lot easier because the health workers had a connection to the people that they were helping. They, like I mentioned, also it offered, connection to COVID vaccination, to help with food, rent, utilities, and other assistance. So yeah, I mean, I'm sorry, I get on a roll.
No, you're fine. No, you're fine. I was just gonna say, building that trust was so important during the pandemic.
Right. Yeah, it was good. And, our community health workers loved their clients as much as the clients loved them. It was very effective. So, obviously they were amazing. They, one cool thing was they even connected a local domestic violence shelter to testing through that mobile COVID test provider who would come to the location at any time. So that meant that a family fleeing domestic violence didn't have to quarantine for 14 days when they first came to the shelter.
Right.
It was amazing. And you know, I could go on and on.
Well,
But,
one question I definitely want to
yeah.
ask you is what can public health advocates do to share the value of CHWs with decision makers? Because we want to know what we can do to help, make the case.
Yeah, that's a great question. You know, in response to COVID, the CDC has brought a lot of grant funding and attention to using community health workers to help vulnerable populations. And as part of that, Tulsa Health Department received almost $7.5 million to establish a health equity office, where a core of community health workers will continue helping our Latinx and Burmese populations, as well as expanding outreach to the Black and African American populations of Tulsa. And we're looking for opportunities to help LGBTQ and deaf and hard of hearing people, since they can often have unique challenges getting good health care. I would have to say, you know, whatever direction that you take as you develop a community health worker program and share about it with decision makers, I think the most important thing is to focus on helping people in a common sense way, to have no other agenda. If you offer a beneficial service, it's very easy to show its value.
Nice. Thank you so much, Jenna. I so appreciate that story, and thanks to Ashley as well. I'm curious if your understanding of how community health workers can advance equity may have changed. So I'm going to ask James to launch a brief poll. And those of you who are on our webinars each month know that we do this really, really quick snapshot poll. And we're going to ask you to respond to it. We're not showing the results or anything like that. It's completely anonymous. And he's going to leave it up for 10 seconds. But just let us know how your understanding may have changed, if at all. And while you're responding to that poll, I want to share a resource with you that was created by our evidence and policy team here at CHR&R. They're the ones who share the evidence about community health workers that I showed you earlier in the webinar. If you are working in rural areas like Jenna is, and like part of Ashley's service area, you know how structural barriers to health can really limit people's just opportunity to have equitable health. So transportation, access to care, all those things are limited when you are in a rural setting. So this report, which is called Strategies to Improve Rural Health, a report, outlines key steps towards building healthy communities. The strategies in this report have been tested in rural areas. And so we're going to share this report with you in your resource guide, because guess what? CHWs is highly recommended for increasing access to care in rural areas. So make sure you check out that report. That'll be in your resource guide. And so now I'm going to shift to Joanne very quickly. See, we have a couple of questions that we can launch before we go into our discussion group.
A couple. Our audience has kept me really busy and on my toes with all the questions that are coming in. It's really great. More questions than we usually get. So it really shows how thought-provoking this webinar has been. So since we do have a time limit, I do want to encourage as many folks who have entered questions in the chat to come on over to the post-webinar discussion group. And I even chatted specifically to some of the questioners, because there's such thoughtful questions that I think we want to hear from not only our presenters, but other folks who are really trying to support community health workers. So with that said, there's two areas that I want to have some common questions from multiple people. And so I will start with Ashley. There were a lot of questions about, okay, this is all great. We know the value of CHWs and what they can do. What are some, I guess, the top 2 or 3 recruitment strategies to get really effective community health workers that you've seen in the roles that you play?
Yeah, thank you for pitching that to me, Joanne. I've actually presented on this topic recently quite a few times. So I'll share with you within my health system, within Baylor Scott White Health, we do employ over 100 community health workers in 7 different departments in 6 different job codes or roles. And so we've been employing community health workers since 2007. So we do have, tenure plus with the workforce. And I'll say that a lot of our recruitment strategies were through lessons learned. So we don't simply always just post the jobs on our website. A lot of times we look to our local coalitions that employ or are already supporting the role in the communities that we're trying to employ them. We also look to the local and statewide community health worker associations. In Texas, we have 7 to 9 at the local level. I say that because sometimes they're in flux because they're community based. Excuse me, or the statewide association, which we're fortunate enough to have, we'll put the calls out to them and say, hey, send this to your members. Also, there are certified training centers in Texas. And so we'll reach out to the directors of those training centers and say, hey, do you have a new student cohort? Are there people that really stood out in those classes that you think would be a good fit for this specific role? And this is what we're looking for. That was all recruitment, right? Not retention.
Yep, recruitment. Okay. Thank you.
I'll stop there.
Thank you so much for giving us some ideas. I don't know, Erica, if we have time for a quick question for Jenna, or do we need to move on?
You know what? I think we're going to move on because I know you have to get over to the discussion group.
I do.
So Joanne, thank you so much. Joanne's going to open up that discussion group. Tommy's getting ready to send out the link in just a few moments. But right now, I am going to ask you, if you would not mind, please share your thoughts about today's webinar. We did definitely take your recommendations and we keep them in mind and we put them into practice. It's how we ended up with this webinar today. We heard what you said. You said you wanted to hear more about CHWs and you got it. So please do share what you think. Tommy's going to chat out a link and you can complete that later on. But make sure you do and just give us your feedback. I appreciate that. Hey, listen, next month on September 28th, I hope you'll be right back here with me because 54% of Americans know someone who has experienced poverty in the US. That means that over half of us here on this webinar likely know at least one person living in poverty. No matter how healthy your county is, disparities still exist in poverty. I can promise you that. Reducing poverty is necessary for a healthy society. And I'm not talking about only physical health, I'm talking about economic health as well. So join us next month as we explore the structural roots to poverty and steps your community can take to address it. And I'm definitely looking forward to that one, I have to say. But we also have a treat for you this month. We talked a lot about what works for health and evidence in this webinar. So I hope you have a feel for how important evidence is. So we have a treat for you in just 2 days on Thursday. We will have a special topics webinar for you to learn more about what works for health. Again, what works for health is the tool that we have on our website that generates evidence-rated strategies for you to review. So it contains over 400 actually strategies. And this brief webinar will explain how you can use what works for health in your equity building work in your community. Simply go to our website to register for this webinar and I will be there on Thursday. So look forward to seeing you there. So we have a presence on Twitter, as you know. I hope that those of you who did tweet chose to follow us. We also have a presence on Facebook. But the best way to know about all of our upcoming webinars, our new tools and resources is to sign up for our newsletter. So make sure that you do that as well. And there will be a link for you to do that in your resource guide. And as we wrap up today's webinar, again, I'm going to invite you to join us to further explore these topics and engage in conversation with fellow audience members. And Tommy's chatting out a link to the discussion group right now. You only have to answer like 2 questions and then you'll be admitted to the group. So I look forward to seeing you there. So thanks to Ashley Rodriguez and Jenna Grant for sharing their wisdom with us today. And listen, thank you all who work so tirelessly in your communities every day to advance equity. We appreciate everything you do. And we appreciate the fact that you spend an hour with us to deepen your learning around community health workers today. I will see you next month, but in a short while, I'll see you in a discussion group. Have a good afternoon, everyone.